Tanzania's president has said the country has been healed of coronavirus through prayer. It is an almighty claim and difficult to challenge because his government hasn't released any data for weeks, and the doctors who know the truth are afraid to speak out.
We have decided to go this way to depend on God. We have started with God and we shall finish with him. In reality, God has answered our prayers. The number of infected patients is dropping.
On a list of countries that the World Health Organization is most worried about, Tanzania comes top. Media reporting is suppressed, journalists are regularly locked up, but the stories are getting out. The interviewees that we spoke to took risks to tell us what's happening. This doctor asked us to disguise his identity. He's afraid of losing his job, or worse.
We were treating people with COVID-19 and those suspected to have COVID-19. When the pandemic came, we were shocked. We hadn't prepared ourselves and we didn't have any guidelines, but we were learning as we went along. There were challenges at that time. The disease was new to us, the doctors were scared, there was no equipment, especially PPE. We were asking ourselves, how are we going to treat these patients without PPE?
Vanilla Jacob's father needed emergency dialysis, but the hospitals were too busy treating coronavirus patients, so they couldn't help him.
We were told to not come outside. A health officer at the emergency department asked my father if he had fever, and my father said no. A nurse asked if my father had a sore throat, and my father said no. They didn't even want to test his temperature, and they told us it was not possible to admit us unless we had tested for coronavirus.
Ndarikia Jacob died that evening, 64 years old. One neighbouring country, Kenya, has closed its borders with Tanzania, and the US Embassy in the capital, Dar es Salaam, warned Americans to stay at home because the city's hospitals are overwhelmed. The government has allowed markets to stay open. There is no social distancing here. A lockdown would have its own catastrophic effects. People quite simply would starve, and so they have no choice.
The government has just provided us with education by educating us to sanitize and to use masks, but it is not possible to prohibit gathering at a market like this. I need money. I can't chase away consumers. There is no safety here. But we only need money and we have nothing to do. We're at risk.
We lack customers because they fear corona. For that, we lack capital. But we advise the government as they have decided that there is no lockdown. But we need the relief fund. We can't afford the health services here during the pandemic. At least if they can provide masks and sanitizer at a low price, it could be helpful.
The Tanzanian government continues to insist there is little to worry about, and coronavirus isn't a threat to health in the country. And anyone who dares to disagree with that position is silenced. Alistair Bunkle, Sky News.